Where is it? Will the vaccine turn me into a zombie in a couple of years?
Because personally, I'd like to know. See if I have to set up.
all of those comments, you know. Imagine this is a spoon. They are exactly that. They are exactly that. So.
Yeah, but it's a fun way of asking the question, is there long-term side effects? All right, so can we just talk about side effects for a couple of minutes? The side effects that most people get, I get the injection in the shoulder. The most common side effect is pain where I got the injection. It happens about, 5 or 10% of the time. The next most common thing is people get a sore shoulder. The whole shoulder's kind of sore for a day or two. That's pretty common, 5 or 10%. Some people faint, but that's just because they're afraid of needles. That's okay. Don't worry about that one. 6 people per million end up with anaphylaxis. Big word. It means severe allergic reaction. It's pretty rare. 6 per million. 6 people per million will have anaphylaxis. And that's why we always do vaccinations at a site where we've got a nurse who can do adrenaline. Because the treatment for anaphylaxis is adrenaline, followed by adrenaline, followed by adrenaline, followed by adrenaline. We just use adrenaline until they've recovered, all right? Just saying, it's pretty easy. And nobody has died from anaphylaxis after Pfizer. So it's a side effect. It's important that we know how to manage it, and we can do it safely. There's one other side effect worth talking about, which is myocarditis, and that's inflammation of the heart muscle. It happens about 10 times per million. It's mostly in men, mostly young men. We've had one case of it in this country. So pretty rare, and almost all of those recover. Our case in New Zealand didn't. Our case was a 53-year-old woman, so very, very rare to see myocarditis in that, and she didn't recover from her myocarditis, just telling the truth. So there's all the side effects. Now, if the question is, could there be a side effect that comes in 10 years' time or 20 years' time? And obviously, I can't be 100% certain, but I'm really, really confident that there won't be. And the reason for that is, if you think about all of our vaccines, we've got measles, mumps, rubella, we've got a Zostavirus, we've got a Novavirus, we've got 10 different vaccines that we do in our regular vaccination program, and none of them have a side effect that comes up 10 years later. None of them have a side effect that comes up 20 years later. So this vaccine, I don't expect it to be any different in that regard. There's almost no chance it's going to have a side effect that comes up 10 or 20 years later. Zombie or not, I think you're going to be fine.
And I think some rangatahi, especially wahine, we'd like to know is there an effect that the vaccine has in making wahine infertile? Can you not get pregnant if you get the vaccine? Yes or no?
Oh, no. It's all good. And we know that. See, again, we can get the studies that tell us that's okay. So when I told you 44,000 people were enrolled in that trial for Pfizer, sweet, there were pregnancies during that, and there's babies born since that time. And then you look at Portugal. So Portugal's got a really highly vaccinated population, and guess what? Their birth rate went up. Right. And it's probably because of lockdown. A lot of people were watching TV. A lot of people were at home. So you know what happened. But I'm just saying, people are fertile. Don't worry about it. It's all good. We're safe on that one.